I will show you how to perform neck treatment for tightening and lifting. Before that, let me briefly explain the anatomical structure of the neck. Neck mainly consists of three parts: anterior neck, lateral neck, and posterior neck. The treatment area for the anterior and lateral neck is from the borderline, the chin and neck, which is below the mentum, to the borderline of the neck and chest, which is the clavicle. And treatment is performed by dividing the left and right sides based on the midline. This is trapezius muscle. And there are sternum, clavicle, and mastoid bones, which are attached to the sternoclavicular-sternoid muscle, the area drawn by the SCM muscle. The borderline between the chin and neck and the midline corresponds to the anterior neck. The area drawn by the SCM muscle, trapezius muscle, and clavicle corresponds to the lateral neck. The area drawn by trapezius muscle, the borderline between the occipital and back neck, the borderline between the back neck and upper back, and the midline at the back, corresponds to the posterior neck. The reason for explaining the anatomical structure of the neck is that the sagging of the neck skin proceeds sequentially from the anterior neck to the lateral neck and the posterior neck. Before treatment, you should examine the degree of skin sagging in each part of the neck to determine which part to treat and how many passes to perform. For neck tightening and lifting, I usually use CW3 mode, 1.0 to 1.5 mm, power 5 to 6, 1 to 2 passes. But Amy has redness on her neck, so I will use PW2 mode instead of CW mode. When treating the anterior neck, pull the skin outward, anchor it, and irradiate RF along the pulling direction. Perform 1 to 2 passes, and a good endpoint is moderate erythema that gradually appears a few minutes after RF irradiation or an immediate improvement. When treating the lateral neck, pull the skin outward, anchor it, and irradiate RF along the pulling direction. Perform 1 to 2 passes, and a good endpoint is moderate erythema that gradually appears a few minutes after RF irradiation or an immediate improvement. When treating the posterior neck, pull the skin towards the midline at the back, anchor it, and irradiate RF along the pulling direction. Perform 1 to 2 passes, and a good endpoint is moderate erythema that gradually appears a few minutes after RF irradiation or an immediate improvement. For neck tightening and lifting, I usually recommend 3 treatments at 1 month intervals. But the number of treatments may vary depending on the age of the patient or the degree of sagging of the skin.